It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
And welcome to U of L Today with Mark Hebert on 93.9 The Ville. This is the show about all the good things and good people at the University of Louisville. What do we got on the show today? Well, too many teens aren't getting mental health help because of the stigma attached by their parents, teachers, and even the media. Those are the findings of a U of L study. We'll talk to the researcher as well as a student who took part in that research. We'll also hear how Kentucky law designed to cut down opioid abuse may only be shifting what kinds of drugs that patients are abusing. But first, e-cigarettes are getting to be big business, but who is using them? Lindsey Thompkins and Kandi are both communications professors at the University of Louisville. They've been studying many facets of e-cigs, including who is using them. Welcome to both of you. Good to see you.
Thanks for having us.
Did I get the titles right, both in communications, right? Or Lindsey?
I'm actually a PhD candidate in the School of Public Health, the Department of Epidemiology there.
Okay, very good. I thought I might have messed that up. So you're in public
That's
health.
okay. She works with us in the Department of Communications.
Folks in communications. All right. Well, let's talk about this study. Who was the leader on this study that kind of looked at, all right, who's using these e-cigs?
So the project in itself is funded under A-TRAC, which is Aruni Bhatnagar, our wonderful leader here at U of L. But the project that we just published was led by several different people across the country. Here at U of L, we had Lindsey, Joy Hart, myself, we're all on it. And we were looking at the social impact or the social factors that are tied to e-cigarette use.
Who's smoking them, right? I mean, what are their incomes? What are their jobs? So what'd you find out? What'd you discover?
Well, so the findings were actually pretty surprising. What we've seen with more conventional tobacco use, like cigarette smoking, is that it's generally people who are less educated and have lower incomes. So that's kind of what we were expecting to see with e-cigarette use, but we actually found the opposite. We actually found that it was the highest income groups and also the most educated individuals and employed individuals who were actually more likely to use e-cigarettes than, the lower counterparts.
Was that just in Kentucky?
That was across the United States. So we were looking at over 2,000 people. We did an online survey looking at all groups across the United States. So it was really surprising to find households over 90,000 were the ones that were more likely to use it, more so than households with under 20,000.
Why do you think that is?
I think it goes back into a lot of the marketing of e-cigarettes. So if we look at what's being sold to us, it's modern, it's savvy, it's clear, it's clean. I mean, all of these really hip words. And so people that are interested in doing the next big thing are trying it out. That's one of the reasons we see the increase in youth using e-cigarettes as well. I mean, it's just how it's being marketed to them.
Lindsey, is it possible that folks who are upper income and who have jobs and are smokers, regular smokers, are using these because they view it as a way to try and quit as a step towards quitting smoking tobacco, or they're more safe? Is that possible?
Well, I mean, I think that's how
that's what they're thinking?
Right. That's what they were thinking, but I don't necessarily think that that's always what we're seeing in our research so far. It's oftentimes, especially with youth in particular, they're not using it as an alternative tobacco product. They're using it just because they're attractive devices on their own. One thing that's interesting about e-cigarettes too, when you consider the income factor, is that there are a lot of really fancy devices out there, devices that you can modify that can get to be very expensive. So that in that aspect, you would maybe expect for this to be more of a high income, more high income users.
We're talking with Lindsey Thompkins, who's from the School of Public Health, and Kandi Walker, our communications professor at the University of Louisville. We're talking about e-cigarettes and some studying they've been doing on that. So why is it important, you think, to study this issue, to look at who is using e-cigs? Why do we care?
We care because it's a public health issue. I know that the verdict is not in yet on is it going to be helpful, is it going to be hurtful, and we really can't say either way. There are times where it's very hurtful, and there are times where it can show a benefit. So as Lindsey was talking about, if we have heavy smokers and they start using e-cigarettes and they reduce their nicotine, absolutely, that's fabulous. But what we see more often now is that we see youth that try e-cigarettes first instead of our conventional cigarettes, and then it leads them into more nicotine use, and then they switch over to being a dual user with cigarettes and e-cigarettes. So it matters because nicotine is a big deal, and especially for our health, our cardiovascular health. And so we need to pay attention to this.
Is there evidence or are there studies that show that this is I'm going to call it a gateway drug, for lack of a better term, a gateway, these e-cigarettes are gateways to cigarettes, to real cigarettes, and nicotine and all the bad stuff in real cigarettes?
Well, that is, we are seeing youth who are starting out using e-cigarettes and then are also picking up on other tobacco products after using e-cigarettes first. So that does give us some indication that that might be the case. There haven't been longitudinal studies, or they're just now, in the works of really trying to figure out, right.
You don't have the year.
Right. To have enough
study,
data to really see if those who start out using e-cigarettes then progress to using other tobacco products as well.
Well, these people that responded to you in your survey, did they list any reasons for starting or smoking e-cigarettes? Was that part of the study?
In part of it, we have studied that in other published pieces. And one of the things that we keep finding over and over again with different populations, youth and young adults, flavoring. Flavoring matters. They're attracted to the cool titles. They're attracted to, it's just cotton candy. It's just gummy bears. It's, all of these fun terms that don't seem like they would have any health risks associated with them. So flavoring, and we're seeing some newer research coming out with just what happens with different types of flavoring advertisements. Is certain flavors appealing to more of the youth, more to the young adult? But overall, it's flavors.
Mm-hmm. But that's a big thing for the youth, but for the folks perhaps that are making $90,000 a year and got good jobs, is that the lure for them as well?
It's the flavoring as well for them.
The flavoring.
Yes. So they may not be attracted to fun cotton candy circus ride, but they might be interested in something that tastes like cotton candy because they don't associate a cotton candy flavor with having a health risk.
Talking with Kandi Walker from the University of Louisville's Communications Department and Lindsey Thompkins, who's with the School of Public Health. I know that we have some researchers at the University of Louisville who are doing a lot of research on e-cigarettes and what the health consequences of smoking them are. And you guys are kind of looking at who's doing it and why they're doing it. So what would you tell folks right now if you were sitting right here and they came and said, I'm going to start smoking e-cigarettes because they're safer than these other ones, or, they taste good, whatever. What advice, just from your experience and the surveys that you've done, would you tell them?
I would say that there's still a lot that we don't know about the health impacts of e-cigarette use, and that we're not actually sure yet if they are safer alternatives, or especially for people that are just picking them up and not even switching over from cigarette use. There's just still so much that we don't know, and so I would say to be cautious about that.
I would ask questions too. I would say, are you a heavy smoker? I mean, no one should be doing e-cigs unless they are trying to use it as a way to combat their addiction to nicotine. We have too much research that says that if you try e-cigarettes first, you're 7 times more likely to smoke cigarettes. So there are consequences to being addicted to the nicotine of e-cigarettes.
And you mentioned youth several times and why they're starting to smoke these e-cigarettes. I'm calling it smoking. Is it inhale? What's the term you use?
Vaping.
Okay, sorry.
Or juuling is the new term if we're talking about juuls.
Well, that's where I was going with
Yes.
it. Speaking of juuling, the FDA recently announced that they were going to launch an investigation into the Juul brand e-cigarettes for potentially or allegedly marketing to young people. What was your reaction when you saw that?
I'm not surprised. If we look at just the Juul company, it's a very large company. It's worth billions of dollars, and they're spending a lot of money on marketing. There is a reason why they spent their advertising dollars on social media instead of doing more traditional advertising on TV or billboards or magazines. There is a reason why they targeted social media. Who's on social media? In their launch party to celebrate their brand, it was a great big party. And what did they do? They used hashtags tags to make it seem like this is socially acceptable again. We spent a lot of time making nicotine and smoking an unacceptable social phenomenon. And now with the e-cigarettes, we are faced again with, is this socially acceptable or not?
Mm-hmm. And I think most people, even the researchers at UofL, Daniel Conklin and others that I've
Absolutely.
talked to, would say that these e-cigs probably are safer. There's some stuff in them that's bad for you, probably, but they are probably safer than the nicotine and the tar and all that stuff in regular old cigarettes. So I guess, I think Jewel and others would say, hey, they're still safer. Sure, they may be causing a little bit of problem, but not as bad as if you smoked regular cigarettes.
But why would, if you are a heavy smoker and you're trying to reduce your nicotine habit, absolutely. But if you're just starting something, why would you put aerosol chemicals? Why would you do that to yourself? These are not water. This is not water vapor. And that's one of those misconceptions about e-cigarettes. This is not water vapor. This isn't just some fun flavoring. This has some consequences. We just can't pinpoint what those consequences are yet.
And again, with targeting youth through advertising with social media and just the sleek designs, being easier to hide in school, that's been some of the concern as well. These are not individuals who are looking to switch from one tobacco product to another. It's, that's the concern here too, is nicotine and brain development. There are a lot of negative impacts there. So there are just a lot of concerns with the people who are just using this as their first tobacco product.
Right. What's the next piece of research you two are going to work on, or one of you is going to work on? What's next?
Well, right now we're looking at some of the advertisements that we're seeing with e-cigarettes, looking at what's happening on Twitter, looking on some of the other social media that are mostly used by youth. We're looking at what kind of advertising, what kind of tweets, what kind of YouTube videos are there, and we're analyzing those.
That sounds like something a communications professor should be looking at.
Absolutely.
All right, Kandi Walker, Lindsey Thompkins, appreciate you being on the show. There is a stigma attached to mental health issues, and nowhere is that stigma felt more deeply, perhaps, than among teenagers. Allison Tu is a senior at DuPont Manual High School here in Louisville. Stephen O'Connor is the associate director of the UofL Depression Center, and they led a research project that looked at mental health stigma among Kentucky teens. Well, welcome to both of you. Good to see you.
Yeah, thanks for having us.
Allison, you're a senior at DuPont Manual, huh?
I am.
What do you want to do when you get out?
That's a great question.
You don't know yet?
Honestly, not really sure. We'll see. I'm really interested in medicine and public health, so that's what I hope to go into.
Well, I think you definitely need to come to the University of Louisville. Have you conned her into doing that yet, Stephen?
We're working on it.
We're working on it? Okay, very good. All right. Well, let's talk about this study that you did on mental health issues and the stigma attached to teens and what they told you as part of this research. So, Allison, what was the study and what did you find?
Absolutely. So this study is one of the big projects of an organization that I started called Stamina, the Student Alliance for Mental Health Innovation and Action. So I started Stamina about 2 years ago after I saw a lot of my friends, a lot of my peers really struggling with their mental health. But for us, for students, no one really seemed to be doing much about it. So I wanted to start an initiative that was entirely student-driven. We're a team of about a dozen students from all across Kentucky, and we do a lot of different projects to improve youth mental health from a bottom-up approach. So this study was one of the big parts of our work. We've been conducting it in partnership with UofL and Dr. O'Connor over the past year or so. What we did is we talked to students and parents and professionals from all across the state to try to understand their perspectives on mental health and specifically mental health stigma.
Okay. What'd you find?
That's a great question.
When you talk to these kids, what'd you find?
So we found a lot of different things because we asked them pretty broad questions to really understand perspectives on mental health. A lot of it had to do with what was causing all the stigma. So in talking to both students from urban and rural areas, we saw that there were a lot of similarities, like students who said social media was a big factor, where they saw a lot of misconceptions, a lot of incorrect information on social media. Students reported really strong influences from their family and their peers, which makes sense. It's the people you're completely surrounded by, and if they have negative attitudes on mental health, you're probably going to have negative attitudes as well. So those were some big findings. We also saw a lot of times in rural areas, sometimes there seemed to be a greater degree of stigma. Part of that had to do with students feeling like, there is this do-it-yourself attitude in rural areas where, you had to do everything on your own. Right, exactly. Suck it up. You have to deal with it. You can't get help for anything. So there was a lot of stigma that came from that as well. And then in terms terms of barriers to resources, we found that students didn't really know a lot about resources that were out there. From working on STEM, and I know a lot about lots of different resources available, whether it's online or in person or through schools that students can use. But a lot of times they just don't know about them or they're not comfortable using them.
I've got a lot of other questions for you, so hold that thought for a second. Stephen O'Connor, how did the UofL Depression Center fit into this study? How did you get involved? Or how did Allison come to you and say, hey, I need somebody to help me do a research project? Or what happened?
Yeah, more or less that's what happened. It's not uncommon for students at Manual to reach out to faculty and ask for some, type of mentorship related to research studies. But when I spoke with Allison about her project, I could tell there was something really special and unique about not just the project, but also her. She'd really thought this through. She'd put a lot of effort into trying to think about, what are the specific things that really impact youth and what role can youth play in terms of addressing mental health stigma. So I was really blown away the first time that we had a phone conversation, really wanted to be part of supporting her effort.
And why is it important from a university research perspective that Stephen O'Connor or others look at this particular issue involving teens, depression, mental health issues?
Well, because it's ubiquitous. I think that you're seeing rising rates across different cohorts as people age, that you're seeing there's greater rates of depression and anxiety. Suicide is the number 2 cause of death for adolescents, and it goes up until age 35. So I just think that there needs to be much more emphasis on an upstream approach to addressing mental health concerns. And one missing piece of that has been the youth voice. I think that we're accustomed to creating things and then delivering it, and then looking for partnerships in a post hoc manner. But I think that if you think about it from, addressing it a priori, what do you think and what would be most effective from a youth perspective, and how can youth be built into actually creating and disseminating and testing, whatever it is that's created for them, by them, then I think they're going to come up with something that has, maybe a better chance of maintaining across time.
Right. We're talking with Stephen O'Connor, who's the Associate Director of the UofL Depression Center, and Allison Tu, who's a senior at DuPont Manual High School here in Louisville, and they launched a study of, I guess, for lack of a better term, the way that students and youth look at mental health issues and why perhaps they're not getting the help they need, right? Is that a fair assessment?
Exactly,
Allison?
yeah.
So I read a little bit about your study, and I think you found that in urban areas, when you interviewed the students, that Black and Hispanic students felt more stigmatized if they went to somebody with their mental health issues. Is that a fair assessment?
Absolutely. And that was one of the big things that was also a difference between rural and urban areas, especially because urban areas tend to be a little bit more diverse. There are more students from more varied ethnic backgrounds. A lot of those students, whether it was African American and Hispanic students, we had a few Asian American students, and just students who were immigrants or children of immigrants as well, talk a lot about how mental health is still considered really taboo in their culture, and they're really not comfortable talking about it with anyone, especially their parents.
So were the parents the biggest force in deciding whether the young person got mental health help, or was it somebody else?
Pretty much. There's basically 2 big ways that students can get help for their mental health. One is through their parents and their family, and when parents and family members aren't supportive, that can be really tough for the student. And the other avenue is through schools. Students, obviously, we have to go to school every day, got to sit down when the bell rings, and that's a great place for there to be mental health services as well. But unfortunately, even when there are services, sometimes they're not very accessible. Like guidance counselors are oftentimes, so busy doing academic things, or they just have so many students to take care of that they don't really have time to spend with each student. And sometimes there are not even really good resources out there. For example, the mental health education has a lot of room for improvement.
Right, and in rural areas, obviously there'd be less opportunity for mental health treatment than there would be in Louisville or Lexington or Covington or someplace like that. And when you went into the rural areas and talked to the students, you mentioned a couple of factors that they mentioned. But one you also brought up, or came up in your study, was religion. Right? Wasn't that one of the factors that a lot of students felt like their parents were telling them, hey...
Right, absolutely. And religion was another one of those big differences between rural and urban areas, because it tends to be a bigger part of rural communities, where it kind of cut both ways. For some students, they felt like their religious community would be super supportive of them, which is fantastic. And they felt like they could talk about mental health or their feelings with like their church community, for example. But unfortunately for other students, we talked to students who said that if they talked to their parents or people in their church about their mental health, they would just be told, oh, you need to go pray more, or like you're not praying enough, or you're not praying correctly. And for students, that can be really tough because they're already having trouble, and then on top of this, they're being told that they're not practicing religion correctly as well, which can be really difficult for students.
Stephen, what do you do with these study results?
Well, I think Allison and Stamina have thought about this as being a needs assessment, and they created something called an ideathon, where we were able to put together a lot of stakeholders from the area, came up with different ideas about, now that you know what these barriers are for people to engage in treatment and things that contribute to stigma, how would you address those in the community? Projects that are designed by youth and delivered by the youth as well, intended for youth. And so we actually have some pretty good ideas. Some are really easy to implement. Others are going to be more comprehensive. So the easier ones to disseminate, they have to do with dinner table conversations among family members. They could be podcasts that are led by students throughout the state of Kentucky. More comprehensive approaches would be actually work with the cabinet on education to try and implement universal mental health focus curricula into high school students, curricula for health during their freshman, sophomore years, so that you're trying to address everybody, not just those who might identify themselves as needing mental health resources.
Allison, is the goal here for you to see, perhaps it should be all of our goals, to see fewer kids committing suicide? Is that one of the main goals here?
Absolutely. That's one of our big goals. And in fact, one of the reasons why I started Stamina was because in 6th grade and then again in high school, I knew 2 students who died by suicide. And for me, it was so shocking to see that we were letting students' mental health get to a point where it's that severe. So one of our big goals is to reduce suicide, but also generally to increase mental health prevention and have better mental health education and awareness.
All right. Well, Allison, too, from DuPont Manual High School, and Stephen O'Connor, thanks. I'm going to talk to you a little bit more after the break. But Allison, congratulations on doing this study. You're a very articulate young lady, and I hope you come to the University of Louisville.
All right. Thank you so much for having me.
All right. We're back with UofL's Stephen O'Connor, who's the Associate Director of the Depression Center at UofL, and he looked at the 2012 Kentucky law aimed at cutting opioid abuse to see what impact it had on painkiller use from patients that were going into the hospital. So, Stephen, let's talk a little bit about this study that you worked on, and tell us what you looked at. We'll start there.
Yeah, sure. Well, what we wanted to see was what were the patterns of opioid use that were reported for patients that were seeking outpatient care in one of 3 different clinical settings. At the University of Louisville outpatient clinic, we have a Suboxone clinic, one for the VA, and then 2 for outpatient clinics in the community. We just wanted to see what types of opiates are people reporting when they show up for their intake appointment, and how that was impacted maybe by the passage of House Bill 1.
So wait a minute. So the opioids they were already taking when they showed up at the clinic? Or
That's
the
right.
opioids they were seeking when they got to the clinic?
No, everyone's seeking Suboxone. If they show up to a Suboxone clinic, they want to start medication-assisted treatment. But we wanted to see what types of opioids they might have been using beforehand. And so we wanted to see whether or not the type that they reported was impacted by the passage of House Bill 1.
And that was in 2012,
That's right.
So your study took place between when and when?
3 years before and 3 years after, 2009 to 2012, and then really it was passed in 2012, but then it really got implemented in 2013, and then the 3 years after that.
All right. So what did you find? What were they from 2009 to 2012 before the new law was passed? What kind of opioids and what kind of painkillers were they taking? And then what did you find after 2012?
Well, there was not a huge presence of heroin that was reported in before House Bill 1. It was more of the sort of opiates that you think about, hydrocodone, that type
Pill
of classic.
form.
Exactly. Those were pretty prominent. But then after the passage of House Bill 1, those really shrunk up in terms of people reporting their use of that when they showed up to the Suboxone clinics. What they were really reporting more than anything was heroin use.
And House Bill 1 did what?
It created more or less a surveillance system so that there's oversight about prescribing and usage of opiates. So you could track someone who might be going from clinic to clinic trying to obtain opiates, or you could track maybe a clinic that is overprescribing opiates.
Which we found in eastern Kentucky and some other places, a lot of doctors and clinics were prescribing a ton of opioids to patients.
Yeah.
So that was a tracking system, basically, to see how much opioids individual patients were getting and how much doctors and clinics were giving out. So they passed that law. The legislature in Kentucky passes that in 2012. So then what'd you find afterwards?
We found that it was most likely effective at reducing the amount of opiate prescribing practices in the state of Kentucky, because people were reporting them, less often when they showed up for medication-assisted treatment. But what we also found was that, potentially by reducing access to those opiates, that it might have had an unintentional consequence of increasing use of heroin as well. It's not a causal research design, so we can't say that actually that's the thing that's causing the increase in heroin use for people who are showing up for medication-assisted treatment. But 2 other studies have found the same type of observational finding, that before and after, it really does seem like the rates of heroin have gone up and the amount of other illicit opiates has gone down.
So the folks who are in pain or are just abusing drugs, period, are going to find a way to do it. If they're not going to get opioids in pill form because of this new law, or it's tougher to get them, they're going to go turn to heroin or something else.
Yeah, potentially. You have a very elevated rate of risk of heroin abuse if you have an addiction to another form of opiate. But again, we really couldn't track people over time to see the extent to which they moved from one form of an opiate use to the next. But I think that's been documented.
And you work at the UofL Depression Center, so what have you seen because of the law, maybe in your job? Are there more folks coming in, or that you're aware of, patients that are coming in looking for any treatment options or any help from the Depression Center? Has it had any impact on you guys?
Yeah, well, so we actually run a separate addiction service through our outpatient clinic. The Depression Center isn't really necessarily associated with it, affiliated, exactly. But our colleagues are doing a great job. I know that they see a lot of people that are able to lead fully functioning lives as family members and working in the community when they are adherent to medication-assisted treatment. Sort of a different approach where you say, we're going to treat this like a chronic condition, and we're going to give you the opportunity to control your symptoms, to have fewer cravings by taking this on a regular basis, and then you can go work in the community. And I think when you're ready to give it a shot to reduce the amount of medication-assisted treatment that you're using, then I think that they support that as well.
All right. Stephen O'Connor, always great to have you on the program. Come back, okay?
Thank you.
All right. Thanks for being on.
Yep.
That'll about do it for this edition of UofL Today with Mark Hebert, which you can hear every Monday and Tuesday night at 6 on 93.9 The Ville. You can also listen to the podcast of the shows on SoundCloud or watch the programs on Metro TV, which is Louisville's government access channel, and KETKY throughout the week. Or just go to UofL's YouTube channel anytime. Check out all the UofL news, videos, and events at UofLnews.com. Thanks for listening to UofL Today with Mark Hebert, and go Cards.